It's a privilege to be here just to introduce the new Spanish platform. This platform follows a very long history background. I mean, we could be, if not the oldest, one of the oldest networks in Europe at the national level. We started at 2000, and it was at the pathology department of a tumor bank. That is the tumor bank that was coordinated by the Spanish National Cancer Research Center. So it was my predecessor who started this pathology department at the CNIO. This is the old, I put it because that was the logo at the time. So they were moving to a tumor bank network for at least 10 years. And during this time, we started to smell the European feeling of the biobank. So this guy, Manuel Morente, started to be involved in some of the European networks. And to be honest to you, I think the Netherlands and Sweden were one of the main promoters of what Jens has been talking to us earlier on, the BBMR. Manuel, my predecessor, he was involved in this phase as well. So then we move from what happens to 2010 to 2020. So the National Health Institute in Spain, that is located where I'm now, at the National Cancer, is a whole compendium there, decided to put money into the Spanish Biobank network. And then it was around, I think at the time, close to 60 biobanks joining this network with common funding for this purpose. But suddenly something changed. As you know, in politics, it could be wherever. But one of the changes was like, okay, we are not, it's not enough with the biobanks. So we are going to expand this, it was a call, again, to make this new platform. And then we included something that was the biomodels. So now, let me see, I'm going to move on. Now we are at the Spanish Biobank network that moves to the Spanish National Biobank and Biomodel platform, and we call it the Institute, the Carlos III Health Institute. For those that were yesterday, Marina Poyan is part of this institute. She was talking about COVID. And at the time was an application open also to be the national platform coordinator. And then it was Nuria Montserrat, who is a fantastic international researcher on organoids. She works very much in the development of these organoids. So how are we organized? Then we have the biobanks, and I'm heading the biobanks at the national level. And then we have another 3 hubs that are organoids, animal models, and 3D printing. So what is the mission? We have a purpose, as anyone has in this kind of platform. And our mission is to offer the highest level of quality, as we talked before, and a state-of-the-art services. We are a service platform. What we want to do is to provide samples from all these models and from human beings, if we can, to facilitate the advance and the best therapy for the patient. And you heard, I mean, everything has been said at this point. We are looking for the benefit of the society. So just to say that we want to be the center, the key point of translational medicine. And this will be translated and other from industry talk in new treatments to improve health and quality of life of the individuals. So now we have the mission, and we go into the vision. What is our vision? Is to become, I mean, we want to be at the international level. We have been proved that we've been already over 11 years as a national network, now platform, but we want to become an international model for companies, clinical research institutions as well as administrations as an infrastructure to be able to perform with a high scientific and technological regulatory perspective and allowed from the design of the product to clinical validation. We want to provide services so we can translate this into the design, not us, but to help into the whole change until we reach an in vivo validation. So where are we today? Well, today, I mean, we have in Spain around 60 biobanks, but when this call was opened to make this new platform, the biobanks, different biobanks applied to this funding to make the platform, but not all the biobanks got funding to be part of the platform. It was a complex, not a complex procedure. We didn't have the time to join efforts to just go to this call as a whole. So we went as biobank individually, and then we had some biobanks that didn't get the funding to be part of the platform. But now what we are evaluating at the moment is to have this, how would I translate it into English? It's like observer. No, it's not an observer, but it's part of the platform. But people that can join forces with us, with that, those that have funding to develop several stages, and they grow together at the same pace as we do, the ones that we got this funding. So they will be associated to the National Biobank and Biomodel platform. So we have, I think this is an update from 2020, but I think we must be close to that. 1,521 collections, around 630,000 samples, and we attend just over 200 requests every year. So as you can see, we are located around the whole country. And this is how we work. And you know, the biobank ecosystem, as you saw, is quite complex. I mean, we have, as my colleague Paco mentioned, an economic framework. We have to interact with a social framework, the science and technological framework, and also to the political and institutional framework. So these are all the stakeholders that a biobank, that is much more, I hope now that you understand, that a storage room is dealing with. And with the health system plus research, we will manage to get into this gear that is going to be translated in what we already heard before, that is new treatments in general and precision diagnostics and medicine, hopefully. So let's move on. There's no any doubt now for all of you that are here that any biobank is built in three main pillars. That is sample quality, as we heard before from one of the short talks from our biobank. You have to assess that you are not ending comparing apple with oranges when you do international, even national projects. So the sample of the quality is extremely important. Then we have to see also these ethical, legal, and societal issues, and of course the data management. We've been following this thread for all these presentations. For this, you will see that we have many activities, but mainly for those two. We have like online window where you can ask us directly, either the researcher that wants to have an ethical approval or an individual that wants to know what is going on with this sample can go to this on-site desktop, online desktop and ask us, and then they will get an answer, the same as a forum, a live forum about sample quality. So, where are our activities? Well, clearly is, I went far, sample management. So what we want is collect and safeguard human samples are their associated data. Our law, we have, we are ruled in a legal framework that is the Royal Decree of Biobanks and the same as the Biomedical Research Act. So we have to do the sample management and guarantee the highest quality, donor confidentiality, we talk about that, and complying with the current ethical and legal regulations. We have to guarantee the procurement of samples alone with comprehensive data, including unique sample collections, different types and pathologies, rare diseases, and samples for healthy donors. Of course, we have to harmonize and harmonize the information and all the quality standard operating procedures across these samples, so the final product has high quality, so academic and clinical and research institutions can perform high quality research. Of course, we want to do open access, an open access platform which serves the biomedical research community, healthcare, and industry. Here, we've been talking about this private-public partnership. We are really keen on this concept, and we are going to move on in achieving this goal. And also, last but not least, I mean, apart from the ethical and legal issues that we've been talking about for the whole 2 days, we've been going to promote public awareness. I mean, we want to deal not only with patient associations, but anyone that is that wants to give, as someone mentioned, I think was in the PhD course, it was Meta. We have also laypersons, but people that have no knowledge in research in our ethical research committees. But now we want to move further and have this interaction with patient associations. So what are the main biobank strategies? The main biobank strategies are the ones that you see there. Is transparency and accountability. I mean, people have to know where a biobank is, and we have to be accountable of this. We have to access, and you will see, because now the next slide is about accessing these human samples for research. We have to provide quality and assurance. We have to promote high quality research, innovation, and of course, one thing that we are doing here now, education. And then we have to preserve, be custodians of this information, and be sure that our donors are not vulnerable at any time of the whole process. But we have a main challenge, and our challenge is where we talk is we have to systematize and standardize the incorporation of this clinical data and donor follow-up. So, thanks to Aro, I have this beautiful word, one-stop shop, gateway. I would also love the gateway. You got it from someone else, I know. Yeah, so this is a chain of stealing knowledge. So this is where we head into. One of the main it wasn't a requirement, it was an advice from this call. It was to have this catalog, this virtual catalog that we could show our potential, and I will explain you why later as well. So we were trying to gather all this information into a catalog that will be part of this one-stop shop. So a researcher could go in, you saw like the Pingenius, go in, locate, but I think it's not, I mean, we are not inventing the wheel, it's all there. You can locate the samples, you can choose the samples, then you retrieve the samples. So all the biobanks involved will provide this information to the researcher that is here, you see. I was being feminist. Look at the beautiful thing, because it's true that even Microsoft is sexist. You look at a researcher, is a man. So I was working during the night after having beautiful talks to Aro, and then I decided to put a female with curly hair. What do you think? And then, of course, the researcher will get all this information from this one-stop shop and get the samples and the data associated. So let's move on, because how long I've been talking now already. So where are we doing? This one-stop shop will be like a shop window. It's a shop window for not only Spain, clearly. We are going to have researchers at the regional, Spain have a lot of autonomous communities. So we want also to communicate, at least at the biobank level, within the country. Then we want to communicate at the European level, because as you heard, we just recently, last month, been incorporated as observers into the BBMR ERIC network. And I'm happy to share with you, because for me it was a kind of, I was obsessed since I was in Sweden. And I'll tell you this story because I was like, how could it be this man, the man that I mentioned before, Manuel Morente, that was in the preparatory phase of BBMR ERIC, didn't manage. I mean, why is not getting Spain into BBMR ERIC? He's making all this structure, basically. He was one of the brains behind it, and nothing happened. So I was moving also, just like trying to be nosy when I was going to Madrid to say to ask, why is not? So I was investigating, and well, it was a no, but without any. I mean, probably they have reasons, but they didn't want to tell me the reasons more. They say, what a nosy lady. So I went back to Sweden. And then when I came back to Spain, I have the privilege, because it's a privilege, to be the scientific node coordinator for my country into BBMR ERIC. For being nosy for so many years, I suppose, like, let's keep her quiet. I think everyone tries to do that. And then, of course, this window will be also our window for international collaborations. That is, as you heard, all of you, is what we are heading to. We want to find partners. Someone said once that the best biobank is an empty biobank. And then I was thinking, that is clever. But the other day, Tim brainstormed, like, if you get rid of all your samples, it's because someone's not getting in. We will be bored. So semi-empty biobank, that's something that the samples are flowing. We want the samples to go. It's the only way that we can prove that a biobank, and also it's a way to be thankful for the donors. I mean, the donors, and it's something that I don't think anyone mentioned, depending on which disease you're talking about. In my own experience, I lost my husband from cancer when I was in Sweden. And I remember that they feel so vulnerable. Donors feel so vulnerable because they want to be cured, if not themselves, if they don't have any chance, the future generations. So they give the sample and everything. They give their lives behind that sample. And it's something that we can't forget, because behind every sample in a biobank, there's a person with hope. And that is our way to thank the donors that we are using the sample in the correct way. So what is then doing Spain as a BBMR observer? I'm going to read it. I have to learn it for the next step. But our goals is nothing more than what we've been doing as a network, is to harmonize into the BBMR ERIC procedures, to increase our visibility, as I showed you before, all this arsenal that we have in our biobanks, to share with the scientific community all over the world, of course, first in Europe. Identify scientific, technological, and medical expertise to provide to the end users state-of-the-art procedures and technology and core competencies in biobanking and biomodels. I mean, I'm not talking about the other 3 hubs because I'm focused on biobanks, but of course, the other 3 hubs will work in a very similar manner. We are going always to work with IT, ethical, and sample management. A gain of international presence as a state strategy in order to be able to participate directly in European competitive projects and strategic initiatives. Of course, further development of Spanish strengths in healthcare integrated biobanking to become a leader partner for academic and industrial research. And last but not least, to bridge academic collaboration with industry by providing research services focused on biotech and pharmaceutical companies. So, as Jen said, and I was thinking, oh, he has the same thoughts as me, together we can. We need to join all the resources. We have a huge potential that can improve our kids, next generations. We need to find the ways to promote this collaboration, and they say to build trust, that we have a common goal, all of us and human beings, that is surviving with life, quality of life, if we cannot be cured. And we saw it with the pandemic. So not much more to say.